ended up here because of Dr. Sattler. Dr. Sattler had been watching my front tooth, and it was noted on an x-ray that the root was being reabsorbed, and it's a tooth that has had 2 root canals. And during a routine x-ray, they found the problem, and he had talked to me about getting an implant, and I asked him who he had recommended. He had given me a list, but then leaned towards Dr. Levine, and so I came here and pretty upset, obviously, knowing that I could possibly lose, well, I ended up losing my front tooth, and I came in here for my first consult and immediately knew that I was in the right place. Everybody from the front desk to Dr. Levine himself were fabulous, listened to my concerns, and were very genuine. So at that consult, I did, they went through this series of, I guess, like a CAT scan and x-rays and pictures and stuff, and he had recommended at that point that I needed to have some straightening of my teeth, because the bottom teeth were pushing and had already pushed the front tooth out of position and forward, and there was a lot of crowding going on. So he actually had recommended Dr. Middleberg at that time. So I got in touch with him, and again, the communication, that he knew I was coming, he knew everything when I got there, what was going on, knew about that I was going to lose the front tooth, and was very helpful. Actually, all of them, Dr. Levine, Dr. Middleberg, and Dr. Sattler, very reassuring in the process of all that, what I would do if I lost my front tooth, so before the implant. So they were all very good that way, and like I said, they were talking to each other right from the beginning. So I did the Invisalign and started that, and I would say I was probably in it for about 7-8 months when they said it was time to look at getting the implant done. Dr. Levine did an excellent job of explaining, and actually even in the beginning, Dr. Sattler, but Dr. Levine explained what was going on with my tooth and why the possibility of actually it breaking off completely or losing it, and trying to be proactive instead of reactive to losing my tooth. So so I had a really good understanding of why I needed to have all of this done. That morning, obviously being nervous, I consider myself a really healthy person. I stay healthy because I don't want to be in a doctor's office or a doctor's chair. So I'm much better on the other side as a nurse than I am as a patient. But they were very kind to me. They obviously had, and I watched them. Being in the field, you kind of have an idea of how things are run, and obviously it's run very smoothly. They have a very regimen, but in a good way, like a set way of doing things, so that they do it right. I'm sure the years of experience, he knows that you have to do A, B, and C to get the same result every time. That's what I felt like. It was a very well-oiled machine. And with all that said, the staff were so supportive and very kind to me, knowing I was very nervous, especially when I started feeling very uncomfortable with the Novocaine. And again, I'm not used to being sick. I don't like being sick. So, they were very, very sweet during that time period. And then after that, it just ran very smoothly, and I could see the way that they worked with each other real well, which was very a confident builder. It really, made me feel confident that I was in the right place, getting it done by the right people. So even before the procedure was done and set up, they had already coordinated with my dentist, with Dr. Sattler, on what I would get. I would go right to his office from here, so that I could get the impressions done, so that I could get the temporary put in, which was important to me because of the work I do and being in front of people, and needing the confidence to be with my patients and other healthcare providers, being able to talk to them and not want to not show my teeth. So they were really good at coordinating the care ahead of time, so I knew exactly what I was going to have to do afterwards. And that was the other thing too. I don't think, not once during this whole process, that I didn't know what my responsibilities were as a patient, which felt really good, because my questions were easily answered, and everybody was very responsive. I would tell them that if they want to be sure that something's going to work and go well, that they would come to Dr. Levine for sure. Yeah, they are very, like I said, very efficient in what they do. They're very passionate about what they do, I think. Maybe that's a way to describe it. And again, they give you the confidence as a patient knowing that you're in good hands.
Smile now?
Oh, of course. I do. Actually, people notice it. They do. I don't know if it's because I am, less self-conscious about a tooth that was discoloring as time was going on. But people actually comment. Even my own family comments on my teeth and everything.
What do they say?
So they're just saying how great the smile looks, and I do get my friends, they'll ask me, I'm at that age where other people have required implants, and I share with them my story and who I think they should go to, and I always give out Dr. Levine's name.